My name is IshikaSharma. I'm a freshman psychology major with a life sciences cluster minor. So my brother is actually autistic, and a few years back he was diagnosed with epilepsy, and just looking at the statistics, it was about 33% of autistic kids usually are diagnosed with epilepsy as well. And so just going to his neurology visits, I always knew I wanted to go to med school. I just didn't know what specifically I wanted to do. So just going there and being able to shadow his neurologist, it really sparked the interest that I do want to work with autistic kids, especially in the future. So neurology is the path that I think I'm gonna stick with for now. So Clemson was not one of my top choices when I was first applying to colleges. It was kind of just in the back of my mind because I kind of knew I was gonna stay in the state. But eventually, coming down to it, I started going to more tours and just getting invited to the different events by the Diversity Affairs Center. It just made me feel really welcome and felt like I would really fit into the environment here. I think you kind of just learn because you realize that not everyone's going to have the same perspective as you on certain things, and you just kind of have to learn to respect that, and you can't, you're not always going to be right. So I think in a really big sense, psychology really teaches you that you need to be more empathetic towards people and just be more understanding. And I guess that's a really important aspect going into medical school and just in the medical field in general. I feel patients, you kind of have to listen to them. Of course you're the doctor and you need to help them, but you also have to listen to them. You can't just treat them like a case. They're also people that are there. So I think I'm really glad I chose psychology as my major before going to med school, so I can really build upon that more.